We're glad to have you back. The FDA is considering a petition calling for cancer warning labels on popular over-the-counter antacids that treat heartburn. Throat cancer is skyrocketing, and many doctors are blaming those medications. Stephanie Stahl explains the connection.
This is my baby.
Joe Moore likes making old things new, but the retired engineer almost didn't get to see his Camaro fully restored.
I started arranging my stuff to die.
When Joe was diagnosed with esophageal cancer, it was advanced. The main symptom, heartburn, had been controlled with antacids that Joe took for 30 years.
It started when I was about 16. It ran in the family.
15 million Americans experience heartburn every day. It's caused by stomach acid backing up into the esophagus. It's usually not serious, except when there's a cancer connection.
So it's a big problem, and it's only going to get worse.
Dr. Anthony Infantolino says most people don't know the connection between heartburn and esophageal cancer.
This is all tumor.
And because antacids usually work so well, they can mask the main symptom.
And that taking these things and feeling better does not decrease your risk of esophageal cancer.
We found out the hard way, and we don't want that to happen to other families.
Monty Mordecai died from esophageal cancer after years of taking antacids for heartburn.
I don't really have the words to tell you what that was like. My husband was an amazing father, an amazing husband.
Mindy Mordecai started the Esophageal Cancer Action Network, ECAN, to raise awareness. ECAN has filed a petition with the FDA calling for new labels on heartburn drugs, warning people about the risk.
And so we believe that the warning labels on those medications need to say something more than heartburn could lead to a serious condition.
The labeling has to be clear that acid reflux heartburn is a risk factor for esophageal cancer.
A statement from Consumer Healthcare Products Association that represents drug makers says in part, evidence from decades of real-world use, current medical literature, and professional guidelines assures patients and physicians that they can have the utmost confidence in the current labeling.
Had no idea.
For Joe, who says he's lucky to be alive and able to eat, he thinks there should be better warnings.
If I would have known about that back then, I would have got scoped and this would have never occurred. It's great to be here.
I'm Stephanie Stahl, KDKA-TV News.
People who have chronic heartburn are advised to get a one-time endoscopic procedure to evaluate their risk for cancer.